Mesdames, Messieurs, sans plus tarder, voici pour vous Platine sur Réservation.
All right, thank you. We are rapidly destroying the lifeline of modern medicine, which are antimicrobials. Hello, I'm Dr. Platine Nyoiki, and I want to discuss with us concerning antimicrobials. Back then in 2019, we received a 40-year-old lawyer known as John. John came in with difficulties to breathe. He had a high fever and he had a severe chest pain. We hospitalized John for the management of a lung infection that was of bacterial origin. Few days later, John only got worse. Now, as he got worse, we tried changing antimicrobials, but everything we did was futile, as John died few days after hospitalization. We were particularly marked by the beautiful wife John left behind, the 5 kids he left, and the family he left behind. John was the only breadwinner for his family, so it was totally devastating. We, the doctors, we are particularly concerned because he came in with an infection that we usually treated with the antimicrobials we gave John. But in John's time, the antimicrobials became ineffective. The story of John highlights the story of 1.3 million people that died globally in 2019 from antimicrobial resistance. Antimicrobial resistance equally contributed to about 5 million deaths globally in the same year. What is antimicrobial resistance? Antimicrobial resistance occurs when bacteria, viruses, fungi, and parasites no longer respond to antimicrobials. So they become resistant. So no matter how much dose you give, the patient keeps being sick like John and dies. Antimicrobial resistance have been named a top threat for global health and community development by the WHO. It places a significant cost on health systems and national economies as a whole. It is unfortunate that it is we humans seated around here that contribute to antimicrobial resistance. How do we contribute to creating antimicrobial resistance? We do this by antimicrobial misuse like antibiotics, antifungals, antivirals, antiparasitics. We misuse them when we have a different disease, but since we don't usually consult, we take another drug to treat a different disease. That's antimicrobial misuse that leads to the resistance. We also misuse antimicrobials by overdose or overuse. When a doctor prescribes for 5 days and we take for 7 days. So humans are at the center of antimicrobial resistance development. You and I seated here are at risk of dying from a common infection, like a common cold, maybe malaria sometimes, because malaria medications are becoming ineffective because we have abused them so much that sometimes kids die in the hospital even after taking the best malaria treatments we have. It is so sad that we are heading into a future where treating basic diseases like malaria, pneumonia, wound infections will become very difficult, and a lot more people are going to die from these superbugs. We therefore have a moral responsibility to look into what we can do to prevent this from escalating. We are heading to a future where treating simple things like surgical procedures, treating people with cancer will become very difficult because these are patients who are always vulnerable to infections. Now, what we can do as humans is to look into ourselves and understand the principles of using antimicrobials. You might think that it is something of the doctors or something of the nurses, but it's totally a no, because antimicrobials are particularly abused by those who are ignorant, who are not in the health field. And it is good to know that each time we have a bacteria, a virus that have become resistant to the drugs we have, everyone is at risk, because the transmission of these infections do not know national boundaries. If Cameroon has an outbreak of a lung infection, that our drugs are not effective to treat, Nigeria will suffer, neighboring countries will suffer, because these infections will spread. So to address this problem, it must be collective, because we are all involved. If you address the problem without your neighbor addressing, your neighbor can develop an antimicrobial resistant pathogen and you get infected later, or maybe your grandmom or your loved one. And the story will be the same, the story of John, who died from antimicrobial resistance. So firstly, we should all avoid the use of antimicrobials when not prescribed by a doctor. We should not use antimicrobials for longer than prescribed by the doctor. And thirdly, we should all join the fight against antimicrobials by sharing this knowledge with our families and with our communities. Thank you so much.